Hello, welcome back to the Bowel Chronicles. I'm Chidera, a pre-assessment nurse in endoscopy. Today I'll be talking about what to expect after a colonic biopsy and what to look out for when you go home. If this is your first time to bump into this channel, I will appreciate if you like, share and subscribe to this channel. Now let's get started. During the colonoscopy, sometimes we do take some tiny samples of the line of your bowel. These samples are called biopsies. Now, this is often a common procedure and is very safe. These samples are very tiny and your bowel heals quickly. There is an important fact you need to note about your bowel. Your large bowel is not sensitive to pain, so you do not need to worry about feeling pain when the samples are taken. Most people feel absolutely fine after this procedure, but there are few things that are completely normal. They include, you may feel mild bloating and cramps as a result of the air used during this procedure. You may also see some streaks of blood in the tissues you use to wipe your back passage and also in the first few bowel movements of yours, especially if you've had polyps removed, which I will discuss in my subsequent videos. Also, if you've had sedation, it is normal to feel tired, drowsy and dizzy because of the sedation. Now, while complications are very rare with this procedure, it is important to take note of the red flags that happens when this procedure occurs. And if this should happen, then you need to report that urgently to the hospital where you have this procedure done. If you start experiencing ongoing and heavy bleeding, which does not stop, especially if it is now beyond the streaks of blood, you start seeing clots of blood in the toilet, then you need to report that. When the abdominal pain does not cease, then it is also worth reporting that to the hospital where you have this procedure. When you start experiencing fever, chills, or feeling generally unwell, if you start feeling that your belly is becoming very hard, tender to touch, then this could suggest the perforation of your bowel. This should be reported urgently to the hospital where you have this procedure. So here are some few tips which could help you with your recovery after the procedure. Take things easy after the procedure. Try and have your rest because you just had an invasive procedure. If you've had sedation, you're not allowed to drive, operate machineries, drink alcohol, or sign any legal binding document, or even make any important decision for 24 hours. And also, you shouldn't just jump into eating normally. You should start off with drinking liquids and move on to eating light meals until your bowel comes back to normal. Do not forget to trust your instinct. Your instinct is key. If something doesn't feel normal, please try and report that urgently to the hospital. Now let's have a recap. If you feel abdominal pain or cramps after the procedure, that's pretty normal. But if these cramps do not stop for a while, then you need to report that to the hospital. Also, it is normal to see streaks of blood in your stool sample. But if the streaks of blood becomes clots, becomes ongoing, then you need to report that to the hospital. I hope this video has helped you with your confidence of what to expect during a colonic biopsy. So if you find this video insightful, I will appreciate if you give me a thumbs up, subscribe to this channel, and also help me share this video to as many people who find it beneficial for their forthcoming procedure. Until I see you in my next video, thanks for watching and take good care of your bowel health.